Hi, Kevin Henry, the Group Editorial Director for Dental Products Report, Modern Hygienist, and Advanstar's Dental Division. And I'm on a Google Hangout today with my friend and America's Dental Hygienist, Anastasia Turchetta. Hey, Anastasia, how are you?
Hey, Kevin, doing great. How about you?
Doing great. Doing really good. I know we're going to talk a little bit about shade matching today and the hygienist's role with that.
Yes.
So just going to talk to you a little bit about that. And is that something that whenever you're doing your clinical days, is that something that you all do, for every patient, or how does that? What do you all do in your practice as far as shade matching goes?
Actually, that's a great question. And being that May is coming upon us and we're getting the graduations and the weddings and Mother's Day, everybody's going to be asking about it. I see like a big push because it's springtime and summer. I have to say it's very few practices that I've been in where that's been a part of the dental hygienist role for the patient. And I'd love to see it happen more often, not only because we want to monitor the results for the whitening, but I really believe we need to, if we're going to go into the overall health of the patient, how do we not know? It would be like not recording recession, and you have a patient say, "Hey, you know what? Have my gums receded?" And I look, and there's no documentation. I'm like, I got nothing for you. It's kind of the same thing with the shade. So, like usually our patients over the age of 50, they're going to start to see a little discoloration. Some medications cause discoloration, but if we don't take this from the start and have a reference point, how are we supposed to know what caused it and realistic results for our patients to get? So it should be done every single time, but I got to tell you, just on the down low here, I haven't done it as often as what I'd like to do it.
Sure. And why is that? Is it just the timing of the appointment? You're really trying to get everything already crammed in, or what's been the main thing that, in your experience, that's kind of held you back?
You name a dental hygienist that says, nobody has any time for that.
Exactly. And honestly, I'm sure it's what a lot of the viewers are thinking right now is, how can I possibly fit that into my schedule?
Right. That takes time to either get the tooth shade out of the guide if you're using it the old-fashioned way and literally match it up. So, you have some options with technology even, but you're right. Does it take time? It does. But once you have it out and you're in, it's like anything else. You're going to have a learning curve if you're using cameras or other pieces of technology. And I would like to see that because that's actually more accurate and we're able to monitor and give that patient realistic expectations. So I'd say it's probably going to take about a minute. But you know what? At first, Kevin, it's going to take a good 5 to 7 minutes.
Sure.
That's valuable time during an appointment.
Well, and you mentioned cameras, and so obviously that you kind of read my mind. There was a really good article on dental practice management about how to effectively use the intraoral camera in the dental practice, and I wanted to get your thoughts about how you feel the intraoral camera should be used.
I think the intraoral camera should be used every single time. There's a good friend of mine, Dr. David Rice, who believes it should be used even once, let's say that patient goes through certain phases of treatment, even if their mouth is at that state of health, why aren't we taking a picture and celebrating that? So I agree with him on that. However, for a shade, I'm not thinking whether it be pixel-wise or you're going to hear a lot on polar eyes. That's huge for practices who are really focusing on anterior aesthetics. It just doesn't give you that shade that you might want. However, if you don't have anything, I'd rather see you use something, and get a reference. But an intraoral shot for shade would not be my preference. It's just not going to really work as effectively.
Well, talk to me about give me some technologies that you really think are very important when it comes to the shade matching, the whitening aspects, and the role that the hygienist plays with all of this.
Well, there's a couple of them. And the first, if you're looking at it from a standpoint, let's just say, okay, we have the dentists who have the buying power, because let's get real, they're going to be the ones who are extending their vision for us to follow through with in the practice. So, you could go as high as, $3,000 for a camera, but I'm sure if you already have an intraoral camera, someone might say, okay, seriously, just use the intraoral camera. This little thing is so cute. It's called Smile Capture, and you can put it on the iPhone. It matches the iPhone 4, 4S, 5, and 5S. It starts off at $60. You download the app, but here's the thing. It has a calibration box, and it has a polarizer. So literally, you place it up there, and it takes a quality photo way better than any intraoral camera for, extraoral could. So if you want to start there, you're looking at a range when you start at like $60 to get everything, the calibration box. I'd say maybe around 500, in and around that. But I just think it's awesome because most of us are going to have an iPhone. So that's a nice investment for us to see and use on that patient and say, okay, we can download that image, send it off to a lab, or show them why whitening might work for them. So smile capture would be the first one. If you want to upgrade, it would be the, I got a cheat here, it would be the Canon G16. That would be another investment. And then, of course, it would be even higher than that would be the Rebel T5i. So these are ones when you're really doing case presentation. But if we're talking shade here for the hygienist, I say use your iPhone and get the smile capture because that's the easiest thing. Calibration, it's no more than the diagonodent calibration. Well, Kevin, we were talking about, to add in if anybody wanted to do more research and extend their hygiene shade guide selection or even extraoral cameras. A good friend of mine who actually speaks on the topic, and he has got a list of companies, of what may be useful in your practice. His name is Dr. Richard Young, and he's out of California. But his website is ryoung, RYOUNG, DDS.com. And if you click on the handouts tab, it'll just give you all that information because that really helped me out in learning what's feasible of how much time I would have in the hygiene department to pick out a shade and use realistically.
Okay, let me pick your brain for just a second here. You said the dentists have the buying power. So talk to me as a hygienist who's in that practice. How do you go to the dentist and say this is important for us to get, and how do you have that conversation?
Oh, that's a great question, actually. I would say, hey, you know what? I saw this or I read about it, I checked this site out, and I really feel that by using this, so we invest up to $500, that we can help our patients have a whiter smile and achieve results that they want to versus over the counter. So I say let's give it a go, and I would actually look at it from a business standpoint and to say we need X amount of whitening patients or whitening kits to finally get the cost of this investment of the app and then go through that training. I mean, to really write it down instead of saying I want this and this is why. Look at it from a cost standpoint and how much is it going to take to get reimbursed for the investment and then keep it going in your practice. You're going to have to use it. If you want it, you're going to have to use it.
Well, and we're going to continue this discussion on whitening and shade matching with our over-the-counter versus, in office, but that's for another Google Hangout, so people will have to link up to that. Yep, so stay tuned for that. But Anastasia, I really appreciate your thoughts on technology and shade matching. I really do. Thanks so much.
Thanks for having me, Kevin.